My name is Rick. I live in Surrey and work in Vancouver as a residential supervisor in a social housing building for mental health and substance use, also working with individuals with a pattern of homelessness. I have a level of anxiety that I live with on a daily basis that I don't know what life is going to look like when I get to work. I could be responding to an overdose crisis, I could be responding to a physical emergency or a psychological emergency. Our members and workers are experiencing a lot of trauma while trying to revive people. We build connections with individuals, we work with them on a long term basis. And even though it's about them, we do feel very invested in what we do. Sometimes we have to administer naloxone and try to revive people. A lot of the time we get success, a lot of the time we don't. The psychological stress that comes from that, I don't feel is being addressed as much as it should. When we don't save that life, our members take that as personal failure. And we know it's not our fault. We didn't do the drugs. We didn't ingest it. We didn't force it into somebody. But we were the last line of defense. And they got through us. And they died. And that alone, the impact on us is terrible. I think that we need to have legislation that comes in that allows individuals working in this sector to have access to the First Responders Act, so they don't have to describe and prove that they've been in an injury when an injury has clearly happened. I rely on my team a lot. There's a lot of people that are working together for this common goal, and we all need to be supported. And when we're supporting each other, everything goes smoothly. We do have debriefing. We have occupational health and safety committees that get together and debrief and make sure that members are okay, but there's not a lot of psychological educated medical treatment that we have. I think people need to be trained about what is open to them when they're dealing with trauma. They need to know what kind of support systems are there. Sometimes there are support systems that we're not aware of. Sometimes we just need someone to listen. Sometimes we need someone to share and understand that what we do is rough. Dealing with people and their challenges become our challenges. And we need the support as well. I hope by hearing my story that people understand that the need for support is out there. It's not just for people that are struggling with mental health, addiction, poverty, homelessness. It's about people that are dealing with people that are going through those things. I have the right to go home in the same condition that I came to work in, and I'm not. How do we fix this?